Today, we're having an important conversation here on Advocate Now. September is Suicide Awareness Month, so we're chatting with Sarah Brummett, a director at the National Action Alliance for Suicide Prevention. Sarah's taking us through some of the incredible work that the Alliance is doing to reduce suicide rates and more. This is Advocate Now. Well, Sarah, you're a director at the National Action Alliance for Suicide Prevention, which is the nation's public-private partnership for preventing suicide. Tell me about some of the work that you're focusing on right now.
Yeah, so thanks for, first of all, highlighting this really important issue. The Action Alliance is a committed group of national leaders from across the public and private sector who have come together with an express purpose of advancing the national strategy for suicide prevention. So it's a group that recognizes that no one organization or area of our society can be successful in isolation. So they've come from federal government, media and entertainment, sports, construction, faith, public safety, veteran serving groups, you name it, to really roll up their sleeves and amplify impact using a shared approach to move the work forward.
And the National Action Alliance is working with more than 250 partners across the U.S. Why is it so important that public and private groups work together to advance the national strategy for suicide prevention?
Yeah, when it comes to suicide, every sector, every organization, every community, every person has a role to play. And we can't just stop working when we're focusing on preventing death. We have to be moving towards building communities that are worth living in and addressing despair. And that takes all of us at every level really coming together. So that's why we see a role for absolutely everyone in every organization.
And the Alliance is focused on three main priority areas to reduce suicide rates. One priority is changing the conversation around suicide prevention. What exactly does that mean, and what changes need to be made?
So how we talk about suicide really matters. It can shape a narrative of shock and despair and crisis, or it can provide hope and strength and offer stories of recovery. Most folks don't realize that over 90% of people who survive a suicide attempt do not go on to die by suicide. Millions of Americans have thoughts of suicide every year, but millions of Americans don't die, thankfully. And the hope is that the more that we talk about suicide and despair and being human, the less alone people will face in those dark times. And so how we talk about suicide can either create an open door to the conversation and support folks in a time of need, or it can further isolate and blame or stigmatize the very real pain that people are experiencing and create additional unnecessary barriers to reaching out for help. So when we're saying we're changing the conversation, it's really about engaging the community in the solution and ensuring that we all see that we have a role to play. And we all experience, the risk factors that can lead to suicidal despair.
And speaking of the community, another priority is transforming communities, because a lot of people view suicide as an individual issue, but it really affects everyone in one way or another. Would you say that's why working at the community level can be so transformative in reducing suicide overall?
Yeah, absolutely. There's no one cause for suicide. There are a number of different community and personal factors that can influence how, when, or if we experience suicidal despair or make an attempt or die by suicide. And so we've got to take a step back, that when we're talking about the drivers for suicidal despair, we're talking about pain and the loss of hope that things can get better. And so what causes us as humans pain can range from, physical, emotional, spiritual, mental, you name it. It could be, loss of a loved one, substance use issues that are creating difficulties at work or with the legal system, financial crises, trauma, violence, all of those things. And really it's getting about to the root of the social context that are giving rise to some of those risk factors and systemic inequities that are often outside of our control as individuals, but have systemic solutions.
And unfortunately, mental health issues are on the rise. Almost 50,000 people took their own lives in 2022, according to the CDC. But as we're discussing now, it really is a systemic issue, as you mentioned. So I want to talk about health systems. What is the National Action Alliance doing to transform healthcare for suicide prevention?
When it comes to supporting healthcare systems, taking an active role in preventing suicide for the communities that they serve, it's really about redefining the role of healthcare as having a very active responsibility to prevent suicide and thinking about moving beyond putting it on the shoulders of an individual mental health clinician or someone working in those systems and really seeing it as a challenge for the system itself to change the way it operates, to bake in policies and practices that support people and support clinicians and the people working in those systems to be able to respond to folks in that moment of need.
And the National Action Alliance is dedicated to empowering organizations and individuals to play a role in suicide prevention. So what can individuals do to get involved?
Yeah, there's a lot that folks can do. We're all part of communities. We all, are part of different families or friend groups, things like that. And really connection to community is the cure, and ensuring that we're talking about well-being and mental health promotion or suicide prevention, ensuring that we're listening to those in our community and taking action. Struggle can be scary. Oftentimes we might be worried we'll say the wrong thing, not know what to say, and that's okay, but it really can't prevent us from taking that step, having that conversation. And so just encouraging folks, if you're worried about someone, ask and ask directly. You don't have to know the solutions or know exactly how to navigate the situation, but letting someone know that you care, that you will listen, you listen to what they're going through. It can be life-saving. And there are resources out there to help folks navigate what might come next, whether that's 988 or the Trevor Project hotline or Trans Lifeline or the Vet Crisis Line. There's resources out there that are available 24/7, 365.
And I want to ask, because prior to working with the National Action Alliance, you were a director at the Colorado Office of Suicide Prevention. Going from a state level to a national level, how would you say the approach for prevention differs?
Yeah, it's definitely, a different landscape. There's differences across the country, regionally and within different communities. And so it's kind of zooming out of that focus area, but the ability to have impact at the national level is just incredibly exciting, especially for this issue that, I know impacts people all across the country, not just here in Colorado. So it's a really exciting opportunity.
Well, it is so important to raise awareness around this topic. Sarah, thank you for all the work you're doing and for talking with us today.
Absolutely. Thank you.
I'm Sonia Baghdadi. Thanks so much for watching and advocating. For more stories and content like this, just head to advocate.com or advocatechannel.com. On tomorrow's episode, well, Anasa, you're a cultural strategist, a writer, director, and producer, and you focus on the future of culture. So I want to start with what might seem like a basic question, but how would you define culture?
Ooh, that's my favorite question. I love that question because so often people collapse conversations about creativity, art making, imagination, and culture, and they're really all very different things. For me, culture is like the social agreements that we make that dictate everything that we do, how we greet each other, how we educate ourselves, how we eat, how we dress. And they're all really dictated by a set of core values that we hold at the center of our society.
The Advocate Channel is here to be a voice for underserved and underrepresented LGBTQ+ and BIPOC communities. Join the conversation. Subscribe on YouTube and Facebook. Download our Roku and Fire TV app. Take us with you. Get the Advocate Channel app on your Apple or Android device. Thanks for watching. I'm Sonia Baghdadi. There's more Advocate Channel after the break.